my name is Caitlin. I'll be your nurse doing your general survey for your head and neck assessment today. Can you tell me your name and your age?
Holly Petrie, 54,
Okay, and can you tell me where you are?
Vidor, Texas.
Okay, and who's the president?
Trump,
Who's the previous president?
Joe Biden.
And what day of the week is it?
Today is Monday.
Okay, and do you have access to 3 balanced meals a day?
Yes, ma'am.
Okay, I checked your height and your weight. It's appropriate to your BMI, which is your body mass index. I'm just assessing your posture right now. You're sitting up nice and straight and everything looks symmetrical. Do you have any physical deformities?
No, ma'am.
Okay, I watched you walk in and your gait was smooth and coordinated without the use of assistive devices. Do you use assistive devices ever, like a cane or a walker?
No, ma'am.
Okay, and how would you say your mood and affect are? Are you generally happy?
Yes, ma'am.
Okay, your speech is clear and understandable. Is English your primary language?
Yes, ma'am.
Okay, and I'm just assessing your hygiene. Your clothes are clean and groomed, your hair is groomed, and your makeup is appropriate. I'm gonna go ahead and I'm gonna wash my hands and I'll start on assessing your head or your cranium. So I'm just checking to make sure that there are no lesions, lumps, or bumps. Do you have any tenderness upon palpation of your scalp?
No, ma'am.
Okay, I'm noting that your hair is dark brown and your scalp is clean and there's no dandruff or infestations. I'm going to move on to your face. I'm going to palpate your sinuses. These are your frontal sinuses and your maxillary sinuses. Do you have any tenderness with palpation?
No, ma'am.
Okay, I'm just assessing your eyes and your eyelashes and your eyebrows. Can you close your eyes for me, please? Okay, great. And open your eyes. There's no redness or swelling or discharge that's noted. I'm going to check for your pupil reaction. If you will, just look straight ahead for me. Okay, and I'm gonna do the other side. Perfect. And if you will, look straight behind me and look back at my pen light. Perfect, your accommodation is intact. So now I'm just assessing your nose. It is nice and symmetrical. There's no redness or drainage or swelling from it. I'm going to assess your ears. They are symmetrical. There's no redness, drainage, or swelling. Do you have any tenderness when I palpate your ears?
No, ma'am.
Okay, and I'm assessing your lips. They are nice and pink and smooth. There's no cracks or lesions. I'm gonna go ahead and I'm gonna assess your neck if you'll look up for me. Your trachea is midline. There's no visible pulsations. I'm gonna go ahead and start on your lymph nodes. I'm going to name them out as I palpate. So these are your pre-auricular, if you'll turn this way, your post-auricular, and turn back this way for me, thank you, and your jugulo-digastric, same thing on this side, okay. This is, if you'll turn this way for me, I'm gonna palpate your occipital on this side, and again on this side, your occipital. This is your posterior cervical chain. I'm gonna do the same on this side. This is your superior cervical chain. I'm sorry, your superficial cervical chain. Superficial cervical chain, and then I'm gonna palpate your deep cervical chain. This is your submental, submandibular, and I'm gonna ask you to shrug your shoulders for me, and I'm palpating your supraclavicular lymph nodes. Go ahead and relax for me. I'm going to now check for your thyroid. So you'll feel my hand right here if you'll turn to the side and swallow. Thank you. And we're gonna do the same on this side and swallow. Perfect. And that concludes my assessment. Do you have any questions?
No, ma'am.
Okay, thank you. I'm going to give a report on a 54-year-old female client who came in for a general survey of the head and neck for an assessment. Her level of consciousness, she was awake, alert, and oriented ×4. She has access to 3 balanced meals a day. Her height and weight were appropriate to her BMI, which is her body mass index. I assessed her posture. She was sitting straight and erect. There was no physical deformities. She denied any physical deformities. I assessed her gait. It was smooth and coordinated. She did not use any assistive devices, and she also denied using any assistive devices. For her mood and affect, she interacted appropriately. She was cooperative and pleasant, and she says that generally she feels happy. She was clear and understandable with her speech, and English is her primary language. She was well groomed. Her personal hygiene was appropriate. Her hair was groomed and her makeup was appropriate. I assessed her cranium or her head. There were no lumps, bumps, or bruises. There was no lesions when I assessed her scalp. It was clean. There were no infestations or dandruff. I then assessed her sinuses. I palpated her frontal and maxillary sinuses, and she denied any tenderness. I then assessed her eyes, her eyelids, her eyelashes, her eyebrows. They were symmetrical. There was no redness, swelling, or drainage noted. Perla was present and her accommodation was intact. I then assessed her nose. It was symmetrical. There was no redness, swelling, or drainage noted. I then assessed her ears. They were symmetrical. She denied any tenderness upon palpation. There was no redness, swelling, or drainage. I then assessed her lips. They were pink and moist. There was no cracking or lesions. There was no drooping. I moved on to her neck. Her trachea was midline. There was no visible pulsations. I assessed all 10 of her lymph nodes, and there was no tenderness upon palpation. I then assessed her thyroid. There was no enlargement and no tenderness upon palpation.